Thank you everyone for joining us for this by name list and coordinated access community practice call to learn more about the work taking place in Brantford and Brant County. We really want to highlight this community who have shown that it is possible really to rapidly and effectively implement a by name list and coordinated access system. We know that they were starting with a strong base and some of the fundamentals had been established. But really they've implemented HIFIS, a by name list and coordinated access all within a 1-year period, despite COVID and a departmental reorg. So excited to hear from these folks. We will start with a land acknowledgement, and I invite you to take this opportunity to put your own land acknowledgement in the chat. From coast to coast to coast, we acknowledge the ancestral territory of all the Inuit, Métis, and First Nations people that call this land home. I am situated on the traditional lands of the Anishinaabe, the Haudenosaunee, and the Neutral peoples, whose presence on these lands continue to this day. And Kat, how about you in Kingston?
I am on the traditional territory of the Anishinaabe, the Haudenosaunee, and the Huron-Wendat.
Wonderful. Thanks, everyone. All right, our presenters today, who you're seeing on the screen. My name is Marie Morrison. I'm the Director of Built for Zero Canada, and I am one of your hosts today, along with Kat Riley, who's the Improvement Advisor working with Brantford. And then our presenters today, we have Hannah Ittner, who is the Project Coordinator with the City of Brantford, working within the Housing Stability Team. She's been working for the city for almost 4 years, of which 3 of those years have been dedicated to planning and implementing coordinated access and HIFIS. And outside of this work, she enjoys camping, watching sci-fi movies, and trying new recipes. Those are fun outside activities. And Victoria Boyle is a community development coordinator with the City of Brantford. She started with the city in 2018 as a case manager with Ontario Works before transitioning to her current role with the Housing Stability Team in July of last year. Victoria is very passionate about the work of the team and loves spending time with her cat, Hank, love that name, her partner and family, eating sushi and drinking coffee. I can relate. All right, this webinar is being brought to you today from the Canadian Alliance to End Homelessness, which leads a national movement of individuals, organizations, and communities working together to end homelessness in Canada, and includes the 5 key initiatives you see listed here. This by name list and coordinated access support for communities is funded in part by the Government of Canada through the CCI funding of Reaching Home. This webinar is part of a series of monthly webinars and community practice calls through the Canadian Alliance that have been taking place from the fall of 2019 till March of 2022. And all the ones for January to March have been posted. You can find them all on the Training and Technical Assistance website, both the upcoming and the archived previous webinars and community practice calls. Just a bit of housekeeping. As always, this call is being recorded. It will be sent out within a few days to all those who have registered, but then it will also be posted on the Training and Technical website that I just showed you. In a moment, I'm going to be enabling closed caption so that you can also see words on your screen and choose to view that or not. Everyone is muted, and we really encourage you to use the chat and/or the question function to make comments and ask questions. Before we jump into Brantford's presentation, I wanted just to highlight some of their recent accomplishments. So they have been working with the Canadian Alliance to confirm Reaching Home level of coordinated access, which they did in December, and they are the 15th community in Canada and the first non-built for zero community to confirm a Reaching Home level quality by name list. Ontario has required that all 47 service managers in Ontario implement a by name list by the end of December, and Brantford confirmed that with CH in December. They then went on to confirm a quality by name list in February. They are the 30th community in Canada to do so and the first non-built for zero community to be confirmed. And they are currently preparing to confirm basic level quality coordinated access with CH. So lots of great work happening there, and very excited to turn it over to our presenters, which I will do now. Thank you, Hannah and Victoria.
Wonderful, thank you so much, Marie. Okay, I'll get to sharing my screen. Perfect. Good afternoon, everyone. We're excited to share the work that's been done in our community, Brantford-Brant. For our presentation today, our goal is to share the strategies that we utilize to help strengthen our community partnerships. This will be accomplished by discussing the following: some background on our community and team, sharing what our coordinated access journey was like. We will provide an overview of our system of care, discuss the key strategies that we use to build strong partnerships, and of course, we will have some time for Q&A. Let's get started.
Great, thank you. So welcome to Brantford-Brant. We'd like to start by sharing some information about our community with you. As the City of Brantford, we're the service manager for both the City of Brantford and Brant County. We're located in southwestern Ontario. You can kind of see on the map there, we're approximately 1 hour southwest of Toronto with a population of approximately 144,000 people, according to the 2021 census. Brant County includes Paris, Ontario, and St. George, and our neighbors include Ohsweken, the Six Nations Reservation. Some pictures here of our community as well. So pictured to the left from the top to the bottom, the top photo is Woodland Cultural Center, which is a museum gallery for Indigenous art, and it's in the former Mohawk Institute Residential School. The center photo is downtown Brantford, and it's showing a Laurier building, which is one of 3 post-secondary schools that we have in Brantford. We have Wilfrid Laurier, Conestoga College, and Six Nations Polytech. And finally, the bottom picture is just some people out enjoying the Grand River, which runs all through our city and has about 70 kilometers of trails around it as well. So for some further context on our community, we've prepared some information to share with you about homelessness in Brantford-Brant. In 2021, our community conducted a point-in-time count survey. The survey is designed to enumerate the number of people experiencing homelessness within our community on a specific night. So on the night of the point-in-time count, it was determined that at least 238 people were experiencing homelessness in our community. So of the 156 individuals that were surveyed, there's some key highlights that we just wanted to point out. So 2 out of 3 of those identified as male, 62% were between the ages of 25 and 55, approximately 36% self-identified as Indigenous, 46% first experienced homelessness as a youth, 58% identified being homeless for 6 months or more within the past year, and 86% identified that they had been living in Brantford-Brant for 1 year or more. And for some further insight into the work that we do in our commission, since January 2021, during our coordinated access implementation, our municipal housing services underwent major transformation. So formerly, we were under the social assistance portfolio. Homelessness services was since moved and separated from that, and we are called housing stability, which you can see in the yellow box on the slide. This was restructured into our current team, which I will introduce on the next slide here. And so our housing stability team is small but mighty, as they say. It's inclusive of a manager, administrative coordinator, Hannah, and myself. We also have a frontline outreach worker based in the library and a data analyst.
Before we implemented HIFIS and coordinated access, our system had the following in place. As the city, we had funding agreements with all of our emergency shelters within our community, and we had funding agreements with 2 housing with supports providers. We had a centralized intake model where clients would be directed to the city-operated housing resource center for all shelter admissions. This centralized approach meant that the city was responsible not only for admissions, but was the lead organization in delivering case management services. Each agency had an internal database. For the city, we were using a system called HART, which stands for Housing Assistance Resource Tracking Tool. This database was created by the city's IT team. As well, we did not have a by name list locally. We did have data capabilities through HART. However, a by name list in the way that we know it now was not something that we had or used for the purposes that we have today. With the previous system, we had some benefits, particularly the direct relationship that we had with shelters and the ability to offer streamlined connections to city services like Ontario Works. However, we did have some limitations. Shelters predominantly worked in silos. While they worked well with the city, they didn't often work with each other. Another limitation was data management. Shelters would fax in paper forms to the city, and case management staff would be responsible for updating HART. This would often lead to delays in data entry simply from the volume of data entry alone. In 2018, we contracted Orco Consulting to complete a review of our system, and they identified a number of opportunities for improvement. These improvements included, but were not limited to, implementing coordinated access to our homelessness system of care, ensuring that our housing system was more focused on housing first, and increasing our emergency shelter capacity, which in 2019, we transitioned one of our transitional housing locations to emergency shelter. So this bumped our emergency shelter locations from 3 to 4. It was truly due to this org code report that our community sought the need to become a reaching home community and to begin our coordinated access journey. Our implementation approach to HIFIS and coordinated access was a thoughtful one, where services were broken down into 3 different phases. We tried to align the phases to a client's flow through the homelessness system of care. We started planning for this project June 2019 and have been able to achieve key deliverables and results by January 2022, making this a approximately 2.5-year undertaking. So our first phase was really about the essentials. During this phase, we focused on developing our privacy agreements, such as our HIFIS community data sharing agreement, HIFIS consent form, as well as the HIFIS confidentiality and user agreement. We started our Coordinated Access Advisory Committee, which comprised initially of funded agencies and our local Indigenous-led housing agency called Haudenosaunee Inc., or Brantford Native Housing. During this phase, we dedicated time to understanding the challenges within our system and refining the inflow processes. And we wanted to focus on implementing HIFIS with all of our emergency shelter partners for basic profile creation and admission tracking. So this phase took just over 1 year, and that includes about a 3 to 4 month gap where the project was on hold due to COVID. Phase 2 focused on case planning and diversion services. During this time, our Housing Resource Center had transferred over to an external agency, the Salvation Army. So we worked expeditiously to ensure that they had HIFIS to support case planning and their diversion pilot project. This phase, to complete the foundational work that needed to be done, took about 4 to 6 months. And phase 3 was dedicated to outflow and prevention services. So really focusing on the by name list pieces, our housing partnerships and stock, and refining matching and referrals. This took a similar amount of time, about 4 to 6 months to complete. So on this slide, you can see more specifics around the project timeline. I'd like to point out some key milestones. So we signed our agreement with Reaching Home back in April 2019. 2 dedicated staff were hired to the project June 2019, myself being one of them as the HIFIS lead, and the other was a community development coordinator. Around this time, we also participated in Acre Consulting Masterclass course, and Ali has been and continues to be an incredible support and resource to us. We really gained momentum on the project in the latter half of 2020, where we were able to launch HIFIS with our MMAH funded agencies between August 2020 and January 2021. And we spent 2021 building out those key pieces around the by name list and coordinated access. So inviting new partners to the table and fulfilling the requirements for a Reaching Home coordinated access system. Since we've implemented our system, we have received the following feedback. The biggest piece has been the improved collaboration between partners. With the ability to collect and share information, we're seeing greater partnership to deliver care. Our processes are even more streamlined with pieces like admissions, diversion, and case management being documented on one shared system. We also have improved data quality. We don't have the delays that we used to when we relied on paper forms. Staff are entering information in real time. So before I move on, I just want to say it hasn't always been easy. Definitely implementing a project like this one in a virtual world can be overwhelming. Personally, it was always a struggle to balance the desire to plan as much as we can so it's perfect, or just go for it. I'd say from my experience where you can plan, but don't be afraid of trying new things and making mistakes. I've made a bunch, yet here we are with a by name list and a growing coordinated access system. We continue to find new mistakes and new solutions. So that'll just say don't be afraid to try something new.
So our homelessness system of care, we call it the BHSC, the Brantford-Brant Homelessness System of Care. And we have various community agencies who work together to support our residents. So this includes the City of Brantford Social Services, our Housing Resource Center, our emergency shelters, our outreach teams, specialized Indigenous services, and health agencies. To support the services of the BHSC, we have some key advisory boards and committees functioning as our governance structure. One being our Community Advisory Board, which provides a critical lens on how we fund our programs. Our Coordinated Access Advisory Committee is responsible for planning and implementing our coordinated access system. Our HIFIS super user group provides a frontline perspective on all things HIFIS, and through the Housing Resource Center, they host shelter conferences and discuss specific situations for coordinated case planning. They do also facilitate complex case discussions involving community partners as needed to support people with higher needs. Some additional insight into what these partners look like. So there's a quick overview of these programs on the slide here. So this includes 4 emergency shelters and currently 1 isolation facility. We also have 2 housing with supports programs, 1 supportive housing program, our Housing Resource Center, Brantford Native Housing, the Grand River Community Health Center, and St. Leonard's Community Services.
For all clients seeking services from our homelessness system of care, we work hard to deliver a no wrong door approach. So if a client engages with an emergency shelter or any agency associated to our BHSC, they will be supported with a connection to our HRC or after hours services. The HRC and after hours ensure that a client is supported with diversion services before they're approved for admission. Once that connection is made to the HRC or after hours, individuals participate in entry point management, where they complete a client profile form, HIFIS consents, and diversion services are provided. For those who aren't diverted, they are connected to shelter services that are appropriate for them. Assessments, case management, and by name list prioritization are completed if applicable. And at this point, referrals and housing supports are delivered, which hopefully results in the individual securing housing.
We wanted to spotlight some unique elements from our services in 2021. So as noted, diversion services are a really key piece of the BHSC. In August, our Housing Resource Center had dedicated staff to support diversion, and we had our highest percentage of successful diversions from shelter admission at 62.2%. Additionally, our isolation facility housed 209 unique clients in 2021, resulting in 7,367 bed nights. In terms of how we did this, we kind of identified 3 major strategies that helped us successfully build collaborative relationships with our community partners. So these include a shared aim, clear policies and procedures, and effective communication.
One of the key factors that helped us to implement our coordinated access system was dedicating time to ensure that all agencies were on the same page. Without the community advocating for your project, you can experience delays, and agencies may work towards different goals. To ensure that our system had a shared aim, we completed activities like business process mapping. This was one of the first activities that we did, where we mapped out a client's journey through the system and talked about each step. With each step, we asked what happens here, what works, and what doesn't. Each year, we develop a work plan with providers. We ask them, what do you want our priorities to be? What would you like to see improved? We also reflect on the work plan in the subsequent year to say, did we accomplish everything? What is outstanding? We host our advisory committee on a monthly basis to stay on top of our deliverables. We provide a space for them to share their feedback and to share the progress that has been made on the work plan. And lastly, and this is a newer activity, we are completing a vision and values activity. The purpose of this activity is to refine how do we as a community want our system to look in the future. When people talk about our system of care, what do we want them to say? We started this activity at our first committee meeting in January of this year, And we continue to engage with our partners and clients to fine-tune this vision and set of values. On this slide, you can see the overall steps that we're taking to complete this activity. Ultimately, we hope to use the vision and values to develop our work plan. We want to share it with our clients and community. And lastly, we will use this to monitor systems alignment. So where there may be tensions around policies and processes, we will ensure that the solutions align with our vision and values. From this activity, we've had some lessons learned. Completing this activity in an iterative way seems to work well. So define, share, refine. This allows everyone to have the opportunity to provide input. We made this activity interactive. We developed activity sheets for people to look at and complete. We also used the Mural website to engage our partners in the committee meeting. And lastly, but most importantly, our main priority is ensuring that this is developed with and by our partners. We have taken the time to engage multiple boards and committees engaged with homelessness, as well as clients to share ideas. This is a newer activity, and we still have some steps to go. For the most part, those staff have really enjoyed this opportunity to engage in a new and positive way. I highly recommend it. Another key strategy that we deployed in our process to develop clear policies and processes, it looks a lot like this. So with our committees, we discuss opportunities for refinement and growth. We ask them to share challenges so that we can explore them. We then conduct a jurisdictional scan regarding specific topics. Phone a friend. I cannot emphasize how helpful other municipalities and the Built for Zero website has been for developing some of our core policies and procedures. We've looked to communities like London, Hamilton, Waterloo, Wellington, Niagara, and of course the Built for Zero team for advice and support. We prepare a draft of the policy and process to share with partners, and we often discuss these in committees so they can walk through it in its entirety. And from these meetings, we get their advice and we make changes. And next, we establish a clear implementation strategy for the policy. So normally we provide a timeline for implementation, and we discuss any supportive resources and trainings that will go alongside it. And finally, we monitor for effectiveness. So we ask our providers, how is it working or how is it not working? We grow and we change. I wanted to share how we approach the development of our by name list policy. So you can find this policy on the Built for Zero website under community examples. On this slide, you can see the general timeline for planning and implementation. We really started this work in June 2021, and it took about 6 months. So some key strategies we used were that we reflected on the 10 steps to create and use a by name list at each advisory committee meeting. This helped us to track our progress, and staff would get excited when we completed a new step. We built processes into existing practices where suitable. We wanted to build around the things that were working really well, like the engagement that our Housing Resource Center was having with shelters on a weekly basis to talk about clients. We developed a training video that walks staff through the policy and steps. That way, everyone in our system of care has the opportunity to understand how it works. And lastly, our by name list is extracted from HIFIS directly via a report developed by Acre Consulting. This works well since it doesn't require additional data entry from staff. It's merely pulling what we're already collecting. We pulled and continue to pull our list every 2 weeks, so we're able to monitor for data quality. Some key insights that I want to share that helps with this piece is we have a really strong template for policies. It helps us to ensure that we cover everything. We typically include job aids and flowcharts with our policies. Visuals have been hugely helpful with understanding. We include examples if possible so staff can reflect on the policy in a real-time scenario. We develop resources for training. We actually have numerous training videos that we've created for staff. This supports staff to complete training at their own pace and to return to resources if they ever need them.
Great. So another key strategy that we identified was effective communication. So for us, effective communication means that community partners trust that they're being heard and that we're going to respond to their needs. So we do this in quite a few different ways. We have multiple committees. So like I mentioned, we have our Coordinated Access Advisory Committee. We also have a Housing Stability Working Group, our Community Advisory Board, and our HIFIS Super User Group, to name a few of them. During these meetings, we will share the by nameless data reliability tool, which really helps to build trust and transparency with agencies and helps them understand the importance of data quality. Additionally, seeing the number of individuals that are housed month to month is encouraging and helps keep staff excited and motivated. We've also worked really hard to create and foster an environment where agencies feel comfortable to share feedback. So this includes things like sending surveys out, allowing agencies time and space to formulate their thoughts and share how they feel most comfortable. So be that in meetings, via email, or the telephone. We also make sure to share the floor during our meetings, and we request input from staff and clients when we implement any change. Another really important thing is to really implement and acknowledge feedback that's provided to ensure individuals can continue to contribute and also let them know they're being listened to. We've found that being responsive to both community and system feedback has worked really well for supporting our ongoing partnerships. So we have a couple of examples of ways that we've utilized effective communication. So as noted, we do have multiple committees and we have worked really hard to be approachable and open to feedback. So one example of this feedback being sought is from our committee satisfaction survey that was prepared by Hannah. So this was triggered from conversations about the effectiveness of our committees. In this survey, committee members were asked their thoughts on things like meeting topics, length, timing, and frequency, and we reviewed the elements of the anonymous results at committee meetings to generate further discussion. In addition to the policies that Hannah discussed, our service restriction policy was created utilizing the policy process that she had mentioned as well. Our providers and community members had indicated that there was a need for change in the way that shelters were restricting individuals, and this process was a pretty significant change to the way that things were being done before. Getting input and buy-in from service providers was imperative to make sure that this was successfully implemented. As we all know, there is a never-ending need for more housing, and in multiple spaces, conversations came up about different ways that we can try and connect with more housing opportunities. So we had an idea to try and tap into the private market by connecting with landlords to see what they're interested in terms of incentives for working with agencies to support housing. Mid-December, we held an engagement session, which had 30 landlords and representatives from landlord associations attend. And we also sent out a subsequent survey, and it was really to have folks have the opportunity to learn about some of the services that are offered, and as well as to get information about the barriers that landlords have to renting and some of the incentives that they might be interested in, specifically to work with our more vulnerable population. For our survey, we did have 57 individuals complete it over the course of a month, and we are in the process of having our data analysts review those results. Finally, our last example here is during our committee meetings, we heard our service providers expressing concern about staff burnout and exhaustion while Omicron was at its height and the pressures that it was putting on our system. So to show staff support, we planned a wellness week to celebrate frontline staff and all of the incredible work that they do. So this included a kindness counts campaign where staff could submit kind words to each other virtually. We also delivered coffee and donuts to our partners, which were generously donated by a local Tim Hortons. We also provided free hot drink coupons to be redeemed later in the week. We partnered with a local yoga studio for a free virtual yoga class, arranged a self-care workshop, and a virtual trivia. And staff really indicated that this was a much needed week of encouragement and that it felt like the events were really planned with them in mind. And so to wrap up, I'd just like to say thank you so much for taking the time to listen to our presentation and hear about our community. This type of work is definitely challenging, and as Hannah noted, we have faced many obstacles. Leaning on the expertise of our community partners, as well as other communities like yourselves and the policies that you've published, plus the Built for Zero team has made my transition into this role a lot easier and definitely has made our work a lot stronger as well. We're so grateful for all of the openness and willingness to share and listen, and to Kat specifically as well, you for your guidance and support along the way that has made this journey so much greater. So thank you again for taking the time to listen to our presentation, and we welcome any questions that you might have.
Thanks so much, Hannah and Victoria. That was amazing. I'm just going to share my screen again here. And we'll get it into slideshow mode. There we go. So we are now at the time to ask questions of our presenters. And I was putting like little notes to myself to ask questions, and I'm sure other folks have questions as well. But while I'm getting those questions kind of organized, Kat, do you have some overall thoughts or things that you've sort of observed, I guess, as magic in terms of what the Brantford-Brant team is doing?
I sure do. I took so many notes during that call as well, of just things that weren't even questions, just like things I wanted to document, like the committee satisfaction survey. I think that is really just like some of the magic in Brantford, is just like the thinking through everything down to, are these meetings valuable? Are people getting the intended purpose? So I loved that. My question is, I really think that what I have observed in working with you guys is a lot of the magic in Brantford is around relationship building. So the number of partners that you have around the table, the way in which you're able to engage people, get them bought in and want to participate is incredible. I'm wondering if you just have any tips on how you're so effective in doing that. Like, what does the engagement process look like? I know you spoke a little bit about, respecting people's, how they want to communicate, giving like different options and time to mull things over. Is there anything else that you feel has been helpful in getting people on board?
Thank you for that question. So I think when I'm trying to think back of whenever we've reached out to a new partner to bring them into the committee or into the work, we usually start with just an overview of where we're at. And I think like a key thing that we always say to our partners is like, you are the experts. You're the ones that are working with the clients, that you're the ones that are working with the system. And it's our job to, support you in whatever way we can. And I think perhaps, and you kind of said this too, is just, inviting a level of participation. So sometimes it's, do you want to come to one committee meeting to see what it's like? Or do you want to have subsequent conversations just one-on-one? So really inviting the different ways that people want to connect. And we just, I guess, like for the most part, we always hit home that, we're on the same team, we're on the same page. We all want to see, the best supports for clients. So I think consistency and the follow-up has been key. And Victoria, I don't know if you want to speak a bit more to that piece, because I know that was your part of the presentation, but like a big part of when we were thinking back and putting this presentation together, we're like, I think the big thing is that, we're listening to the expertise and we're responding to it with whatever effort we have. So I don't know, Victoria, if you wanted to add anything to that.
I just have a couple little add-ons. I would say one would be persistence. Sometimes if things don't work out at first, that's okay. And letting people know, even with bringing them onto HIFIS and with bringing them into coordinated access, letting them know, like, if now is not the time, then that's okay. We can always revisit this. It's not like here's an opportunity and the door is closed forever. So sometimes just really revisiting that conversation, definitely respecting people's workload. And so sometimes even saying like, I've connected with you, but if you're not the best person for this, is there somebody who you could appoint on behalf of your entire organization to attend? That way it's not necessarily the same person always getting inundated. But I would definitely say persistence is another one. Persistence, consistency, all of those types of things.
Love it. That's great. We have a question here about Indigenous partners. Have they been engaged in HIFIS? And if so, what was the engagement process? And I'm wondering actually if you could even speak more broadly to just generally your engagement with Indigenous partners and any conversations you've been having around data sovereignty, if any?
So that's a wonderful question. So throughout the planning of coordinated access in HIFIS, we've always had Haudenosaunee Inc. or Brantford Native Housing sitting at the table and really participating in conversations around process and flow. So right now, they are not currently on HIFIS, but we are in the process of actually bringing them on board. And it's been a bit of a longer process. At first, we did have a lot of conversations around data sovereignty, and how I personally navigated that is I welcomed the discussion. I said, listen, this is a system for everyone. Whatever feels right for you and for your organization, let's make it work. And so currently the organization is looking to actually join us on HIFIS, but at first it was, building that trust and building that relationship and providing assurances that, we want to be collaborative. And if they need access to their data, how do they get it and things like that. And so that's how that conversation has gone. It's been, a long time build, but we're, at a place where they're actually looking to join on HIFIS and just inviting whatever way you want to join HIFIS, if that's the path you want to take, we welcome it. It's outside of Brantford Native Housing. We have engaged with the Aboriginal Health Center, Dedois de Desnay, in different discussions around how we support clients, be it at our isolation facility or even in our system of care. And again, to Victoria's point of, just kind of coming back and following up and engaging time and time again has been important. And I'd say moving forward, we are hoping to build that collaboration. We have some wonderful partners in our community who have engaged with, when we were trying to, but COVID had other plans, trying to plan a registry week event. We had them on board and we were able to build some wonderful relationships there. So that'll to say it's continuing to grow, and we've really seen that relationship blossom, which has been tremendous. That was a long-winded response to that question. I hope that was okay.
That's a great response. Thank you. I know that one of the things sometimes communities struggle with is what is the right kind of organization of all of their committees for input, how not to repeat things at tables and over-engage people, but have the right conversations. And so, just wondering how you kind of came up with your committee structure, and particularly what is the difference between your Coordinated Access Advisory Committee and your Housing Stability Working Group?
So, Victoria, if you don't mind me answering that, or do you want to answer that?
I don't know if you can see me. I'm sharing the floor with you. Go ahead, Hannah. You got this.
Okay. So the Coordinated Access Advisory Committee, we created that first when we were, first joining Reaching Home and starting to look at implementing coordinated access. The Housing Stability Working Group actually came out of a different group. It's an evolution of one. When the pandemic first came to be and was making waves, that group was actually very much so focused on healthcare connections to folks that are experiencing homelessness. So making sure that they had access to those resources, be it in isolation or even at the shelter level. And so it evolved, as, cases went down or as the need for weekly meetings kind of reduced, we had this really wonderful group together that included health partners and, at a table that we didn't have before. And so that's what the Housing Stability Working Group is much more focused on, is those healthcare connections to our shelter system. Admittedly, there is, we're seeing a slight bit of overlap because our coordinated access system has actually evolved to include more healthcare partnerships. So there is a touch of overlap, but the partners are somewhat similar with a slightly different focus, if that makes sense.
Yeah. And we know, that probably continues to evolve, but was just curious about that. And completely. You mentioned your healthcare, and, we're always radar up, we've, any community that's engaged healthcare providers in their work. And it sounds like you have both outreach and something happening at the shelter. And I'm wondering kind of how those came about, who funds them, are they continuing sort of post-COVID?
I have to say, the credit has to go to the partners that we work with, as well as our housing stability team, both current and in the past, because when this first came to be, there was a wonderful connection made with our health unit as well as Grand River Community Health Center. So I think there was some really wonderful leadership. It continues to be. We have a shelter health program that actually a nurse is deployed to the shelters to actually engage with clients and provide that level of care. And our outreach team, that's a wonderful connection with St. Leonard's Community Services. They've actually created this team that engages with clients to offer harm reduction supports. And fortunately, I think, again, connecting to that earlier point of, reaching out and saying, oh, we have this group, this would be wonderful if we could connect, has just, I think, helped build the relationships in a more fulsome way. But I would say that's where it really originated, at least the Grand River partnership. And then the Brantford Downtown Outreach Team, sorry, I'm jumping around a bit. BDOT, we call it, led by St. Leonard's. That was actually a pilot project. I believe, and Victoria, correct me if I'm wrong, I think that was a pilot project with St. Leonard's that started, I think, just before COVID, and they were able to continue on with the project in the last year or so. Victoria, do you think does that sound right?
That sounds right, yes.
Yeah, so I think that it's just a huge credit to the partners and the leadership that's there, for sure, that these healthcare connections continue on and continue to grow. And we're actually looking to connect with the hospital, and, looking at that discharge process of how can we make that better. And yeah, I just think we have some really wonderful partners.
Nice. So those weren't funded necessarily from homelessness response funds. Those were more within other sources.
So I think that there is funding, and Anthony is actually on the call if he wants to chime in. We do provide some funding to Grand River Community Health Center, so that's correct. So we do provide some funding to their programming that they offer. I'm unsure if we can. The funding is a little bit just above my scope.
And I just allowed Anthony.
That's okay.
Perfect.
That's okay.
Anthony, please.
Thanks, Hannah and Marie. Yeah, so we were able to utilize, obviously, some of our SURF funding that was provided throughout the pandemic to create and initiate some of those partnerships with the healthcare providers, so the Grand Rivers and also St. Leonard's as well. So right now we are continuing to fund an initiative through Grand River, and that is in the form of the hygiene station. So that was kind of initiated out of COVID as well, and we are looking to continue on assisting with that partnership until the end of 2022 at this point in time. We did reach out to our community advisory board, and they were fully supportive of using some of the federal dollars towards that initiative as well.
Okay, great. It's amazing. Okay, I have one. I'm going to go to this great question that Elijah has asked about the biggest challenge. So just think about that, your biggest challenge and how you faced it. But I was curious about your library outreach worker, like how that came about, how is it working? Because I think more and more people are making some of these connections to libraries, but the fact that you have an in-house team kind of connection to your library, that's really interesting.
I can try and provide a bit of an answer here. So our library outreach worker, her name is Amanda. And so my understanding, and again, perhaps Anthony can correct me if I'm incorrect here, I believe that her position is partially on our team, and then she also is partially through the library. So she has a manager on both sides. And I think that's also where parts of the funding come is from both sides. So that's really great. It's a great resource to be able to offer to clients. I see Anthony, I believe, is unmuted here. He may be able to provide some more of the background of how that position came to be, or perhaps Hannah can. This was before my time.
Well, I also want to say, I think if Joe's on the call. I think I just got a message from Joe because Joe also has some background on this as well.
Yeah,
Yeah.
It's up to Anthony. I'm good. I'm good to
Oh,
sit in silence.
No,
or-
perfect.
that's totally fine. So Victoria kind of hit the nail on the head. The partnership came kind of to fruition back in January of 2021, when the partnership was proposed for a 1-year term that was going to be co-funded with the library, with the use of, again, some social services relief funding that had to be fully expensed by the end of 2021. So that role right now is set to expire. Pretty much and as Victoria had mentioned, that role answers both to the manager of housing stability, so myself, as well as the library manager. We are actually working with the library right now on extending that role, but that would be fully funded through the library. However, because of the great work that role's been able to accomplish in the year pilot, we will be looking to keeping them obviously engaged with our system of care. They provide great services through that point of entry, and they would be fully connected with HIFIS as well. So not losing everything, it's just simply that how that position is funded will be changing, but not lost in the system of care.
Amazing. We have a little section on our website kind of dedicated to library work. So if you ever have like a position description or an evaluation of that pilot, we'd love to like lift up that for other communities too, because that's a really great partnership. Okay, so this was the big question. What's the biggest challenge you faced and how have you dealt with it?
My goodness. There, there have been a lot of, I mean, you can't not say that, you go through implementing something during a pandemic. That was probably one of the biggest challenges. Absolutely. And I would say it was a bit of a challenge going through the departmental reorg. So just that, having so many changes and so many things happening at once. And so I think for myself and, Anthony, Joe, Victoria, you might have different answers, but I think keeping your eye on the prize, I guess, would be like my way of, capturing it in one sentence. Having a strong work plan. And I actually would say that the number one overcoming item was the partners. We have really tremendous relationships and they're incredible, helpful, supportive, wonderful, every lovely positive word in the books, I would say about our partners, because they've absolutely also kept us on track, and that candidness and openness when there were, obstacles that they were facing, and that collaborative approach to overcoming those challenges. It's intangible how wonderful that's been. Like I think back to when we were going through transitioning our housing resource center from being with the city to being now with an external agency. The partners that we worked with, a big shout out to Julia Iannino. She's the program manager for this program, and she's so engaged and so helpful and supportive. So I think don't be afraid to lean on the people around you. I said a few different things, but when it really comes down to it, I think it has to do with the partners. They really kept us on track. But I've kind of passed it over to my teammates to share what they think as well.
That's a great question. For me, it's a little different because I came into this role kind of mid-year last year. So it's different than Hannah, who's been here kind of since the get-go. It's a little bit different, but I would say for me, my biggest challenge would be kind of trying to get a good understanding of all of the different partners' goals outside of course, helping people and housing people, those kinds of things, and kind of trying to to figure out where all of those fit and how we can all just really work better together and how we can really achieve that coordinated access. I would say kind of trying to conceptualize it has been the biggest challenge, but also the most rewarding piece, to be able to kind of see all of the pieces come together. So really just working with all different agencies, with all different staff, with all different capabilities, with all different needs, and bringing all of those people together, and finding that common ground so that we can all really work well together, I would say is the biggest challenge and the most rewarding piece too.
And Anthony, I think you can talk again if you need to share more. Yeah.
Sorry, I was actually just going to reference the challenges with being fully kind of online throughout the pandemic, and really just echoing some of Hannah's statements about, some of the biggest challenges is the fact that we were doing this throughout the pandemic, and the shuffling of kind of staff. And, I've been in the role now for 10 months, and really, it's just about having that meaningful engagement with community partners, creating those relationships, maintaining those relationships, and doing it all electronically, while trying to ensure, that the clients that we serve are being safe. Yeah, it was tough, but I mean, kudos to my team for pulling through and obtaining these results throughout the last year.
Thanks, Anthony. So we have a question here. If you could just say who gets access, like how your HIFIS is managed a little bit, who gets access to pull the aggregate data versus the unique identifier list? Does the city hold the HIFIS agreement? And, are you the one sort of setting the access parameters, that sort of thing?
So sort of yes to all the things that you just said, Marie. So as a service manager, we host HIFIS. So all of the HIFIS community data sharing agreements are with us. In terms of how a user gets brought on board, so we actually manage that as well. So what we do is we prepare a training package for that service provider for that new user. This training package includes a training checklist that includes all the modules that we've created and some activities, and then the user agreement. So there's that three, or that, I guess, two of the tiers of the ways that we protect client information. So that data sharing agreement and the HIFIS confidentiality and user agreement. So users are created by us, and we also design the user templates. But I do want to say that the user templates are designed in partnership with our community providers. That's where that HIFIS super user group comes into play. So we kind of hear, the challenges or the opportunities, I like to think about it more as, for improvement, and we really build HIFIS around their experience. So while we're the lead, they're really informing that work, and that's how we designed the templates initially as well. And then in terms of access to like the reports piece, it's a little bit different. So we actually are solely the ones that can access that particular module for reports. But what we do is we, on a weekly or bi-weekly basis, we pull specific reports that our partners need and we distribute it to them. So including client lists, bed nights monthly if they need to report in their own way, things like that. So we kind of mutually acknowledge that, you're providing us with this information. What you need, we'll try to give it back. And we'll create reports that they may need and things like that. So we host that aggregate reporting function, but we try to be as helpful and supportive as possible with whatever their data needs are. I think that covers all the questions. Okay.
I'll just add the one other piece that kind of goes along with this in terms of, and maybe this is still under discussion with your Indigenous partners, but just in terms of how they are able to pull and access sort of Indigenous data.
Yeah, so it would be a similar piece where we've shown them the different reports that are available in HIFIS. So again, if when we spoke to them, for example, one of the modules that they found particularly interesting was the goods and services piece. They have a front desk window that often people will come in, receive a good or service, and they just want somewhere to track that. And so for us, anytime that they would need that report, we would pull it and send it to them. And they would at any time have access to those reports. It wouldn't be a challenge at all.
That's great. Wonderful. Kat, any final words from you? Any other, magic? Like, I'm just thinking how quickly turnaround on things happens, sort of responsiveness, documentation, strengths. Yeah, so many strengths. Any final words, Kat?
Just that it's so incredible to work with Brantford. It was interesting walking through the timeline for how you've implemented things, because I have only kind of recently joined working with you guys, but really realizing that the bulk of your implementation, like your HIFIS implementation and all of this launch, happened during a pandemic. And so not only like continuing to persevere through it, but actually really just starting and getting things off the ground. It's really admirable that you have made the progress that you have. Every time we identify a next step, it's, the turnaround between here's what we need to do next and here's when it's accomplished is incredible. So yeah, it's really just a pleasure to work with you guys, and I'm excited to hear about what's next. And I guess that would be my only parting question is, what is next? What's on your radar coming up?
So Victoria, I don't know if you want to take that one on or.
Oh, what is next? That's a great question, Kat. I don't have my to-do list in front of me. I feel like something that's really great about this work in our roles is we get to do a lot of dreaming and thinking up solutions. So I think that's how we spend not a lot, but we spend some time, Hannah and I, often dreaming up of different solutions to problems that present themselves in committee meetings and in just the world in general. So probably coming up with some more solutions. Like Hannah said, we are in contact with the hospital. So we're doing some work with them to see how we can better align services with them. We are still hoping to plan a registry week very soon for the spring, because that was put on hold because of the winter and COVID and all of that stuff. We're hoping to host future landlord engagement conversations to continue that conversation that we started in December and see where we can go with the private market. Those are a couple of things from the top of my head. Hannah, what else do you got?
I would say as well, we're hoping to finalize a vision and values with our committee and, look at the work planning piece. And we're also doing a deeper dive into case planning. Kat had shared with us the bucket activity. So we actually want to walk through that with our partners to see if, we can build out the case conferencing by name list connection a bit more. So stay tuned for that. Hopefully that we have some interesting activities coming up. But I feel like, Victoria, you covered a lot of them. So yeah, we're a pair of, our whole team, our whole sector is a lot of dreamers. So we work really well together, I think.
Got a great crew. Well, we're like 1 minute to the hour. That was perfectly timed. Thank you so much for your time in preparing the presentation. Thank you to everyone who has joined us. Again, we'll be sending this information out directly to you, and we hope you have a great rest of your week. Thanks, everyone.
Thanks, everyone.
Bye now.